Hello everyone, you are all welcome to lecture number 1324, and today's topic is toxic truth of constipation and how it is poisoning our whole body. And if I am saying toxicity or toxic means poisonous, the difference in poison, something is poisonous and something is toxic means slow poisoning is called toxic. Spontaneous poisoning, where you are once you will take immediately within 10 minutes, you will die. That is called poison. But the material or substance or any symptom or any condition, health condition, for long duration of time, your body is under poison. That is called toxicity. So constipation, I consider it as a medicinal chemist, organic chemist, is a poison, slow poison. But many of us don't understand, and it is directly related to your metabolic syndrome, or in other words, we call it lifestyle. Lifestyle means nowadays, what I am discussing is, I have gone through a lot of recent research publications, studies, and it has direct link to different type of health condition and diseases. And constipation is not a disease, it is a symptom. It is your health condition. And that symptom and health condition, for that you are directly responsible, nobody else. Because it is directly related to your food. Food means there are two types of food. One type of food we call it dead food. And one we call it live food, means it is refined and it is natural, means it is with fiber, fruit and vegetable, and here it is lot of refined product, junk food and meat and lot of deep fried food. So, and this two group of food, in a very simple language we call it alkaline food. And if you are taking lot of animal product like meat, red meat, goat meat, sheep meat, yam meat, whatever it is, beef, it is under acidic food. And why I am calling it dead food? Because all this junk, acidic food with lot of red meat, fat, oil, is making your intestine, that is 27 feet intestine, in acidic medium. And in that acidic medium, there are some microbes, there are some cells, they multiply very fast. For example, cancer cell. Cancer cell multiply very quickly in acidic medium. That's why colon cancer, colorectum we call it, is directly linked to your constipation. And some other diseases like rheumatoid arthritis, that is autoimmune disease, is linked to your constipation. Your kidney problem, urinary infection is directly linked to your constipation. Why I am saying this? I have gone through the research publications of 2025 and 2023, 2022. The recent publications, they have mentioned all these factors. So first thing is that you shift to fiber-rich food diet. And fiber-rich diet means 75 to 80% fruit and vegetables. And of course, you can add some of the uh, dairy product like yogurt, milk, cheese, all these only up to 20 to 25%. Your this problem will be taken care. But still, if you are not doing that, it is your personal choice, then definitely there is always high risk of getting constipation. Constipation is defined as that if there is no smooth movement of bowel, sometimes if you are going only twice or once in a week, such conditions are also there. It indicates that you are having chronic constipation. And constipation means overstaying of all those food materials what you have taken. And overstaying means they will be stuck to your 27 feet intestine and there will be fermentation, bacterial attack on those foods which are staying for 4 or 5 days. If you are going at least 4 times in a week, your constipation is not chronic. We can say it is acute, means mild. And you can consult your gastrointestinal doctor and endocrinologist, because in female it has been found on the basis of publications what I have seen that after menopause and after pregnancy there is lot of disbalance or disturbance of secretion of different type of hormones, and endocrinologist will take care of your hormonal problem. So 2 doctors are very important, one gastrointestinal and second endocrinologist if you have constipation. And that constipation is linked to so many diseases, it's unbelievable. And in the world people are silent on constipation. The reported cases are especially in Europe. So there are a lot of diseases which are linked here. Even your mental, your memory, your have the link to constipation. And those people who are suffering from such health conditions like Parkinson's, they will be having constipation. And globally, what I am mentioning, 90% people, they are suffering from constipation symptoms, but they are not reporting. And as per report, the senior citizens, those who are above 60 years, are suffering most. And in Europe and America, it goes up to 80%. Especially in Europe, it's very common constipation. In Africa and Asia, also in senior citizen, it is from 60, it is having range from 60 to 70%. But overall, if you include all those cases which are not reported, it goes up to 90% of the global population. They are having the symptom of constipation and they used to carry on. So let me show you some of the diseases of constipation. Now you can see the image. It is because of chronic constipation, and because of that chronic constipation there will be inflammation and sharp pain, unbearable pain of stool not passing, and it is staying for long time. It is the symptom of constipation where you are sitting here and the bowel movement is not there and it is very difficult and you are in pain, and it is really very serious condition of constipation where the bowel movement is not smooth and you have to spend a lot of time in toilet to make sure that you are flushing out all the waste material in the form of bowel movement. This is the image of colon cancer, colorectal cancer, and it is directly linked, as per research publications, to your constipation. That constipation, I call it poison or slow poison, that is in the form of toxicity. That's why I have mentioned the toxic condition of constipation, which is disturbing your whole body in the form of poison. And first victim is your intestine. Once it is staying for a long time, they are fermented, especially the refined one, and that fermentation is causing irritation to your intestine, and that irritation of intestine is leading to intestine, colon cancer, colorectal cancer, and this is very, very dangerous unless the you consult your oncologist and gastrointestinal consultant, and they will advise you. Finally, it is better to go for intestinal operation, surgery, and remove that portion. But your doctor will advise. So here my handwritten summary is given. I have just summarized lot of publications, and some points I have not given here because there is no enough space, but those points I have already discussed in my lecture. So here, number one is constipation. You have to define what is constipation, you should know. It's a very common gastrointestinal disorder characterized by infrequent bowel movements, and that is hard or lumpy stools and difficulty passing stools. It is a symptom, not disease. I have already told you all these factors, and it can be acute or chronic, means it can be mild or it can be chronic disorder. Less than 3 bowels per week is characterized that the person is suffering from acute constipation. If he is having less than 3 bowel per week, means once or twice, means he is suffering from constipation, and is defined as constipation. Constipation can poison your body. I have already told you even in my topic it is written, the toxic truth of constipation. It can poison, and toxicity itself is poison, slow poison, and poison your body and can build up toxins. I have already told you that this long stay of your refined food, that is called dead food or junk food, is the best platform for bacteria to multiply and to ferment, and it will be in the form of food poison or food toxicity in your body, causing a range of diseases including your skin problems. 90% your skin problem is directly related to your constipation. Number 2, constipation is silent killer and can lead to colorectal, that is called colon cancer. And it is very important to have a regular bowel movement. If it, in case it is not regular movement, it is high time to go to gastrointestinal and endocrinal consultant to have their opinion, and they will give some laxative is already available and they will prescribe it. That is the bowel movement to prevent colon cancer. Number 3, gut health. Gut health can affect mental health. If your gut, your digestive system is not healthy, mentally you will not be healthy. you will feel irritated, you will feel that you are losing your memory, your concentration. Is directly linked to your mental health. If mentally you are not feeling well, it clearly indicates that you have gut problem, and that is constipation. Affect mental health, and it can disturb gut microbiome. So gut microbiome, when they are disturbed, means gut bacteria. And if negative bacteria are more in acidic medium, that is going to create the serious problem of constipation. That's why follow fiber-rich diet, that is called live fruit and vegetable, and that will provide alkaline medium for your gut microbiome to thrive in that medium. Then constipation can cause chronic pain. You have seen it in the photo, that how somebody is having sharp pain and unbearable. In that case, consult your gastrointestinal doctor. And number 5, constipation can sabotage your weight loss. If suppose you are interested to reduce your weight and you are having constipation, it can sabotage. You cannot lose your weight. That is very, very important. Now I have given the link between constipation and different diseases. And that is your lifestyle disease, I call it. Cardiovascular, cancer, all these diseases, here and there, they are linked with your constipation. So number 1 is, that is diverticulitis. Diverticulitis means it is the inflammation of your intestine. That is called diverticulitis. Number 2, hemorrhoids. Hemorrhoids means it is swollen veins in your rectum. Number 3, fecal impaction. Fecal impaction means that is the stool becomes impacted in the rectum. That is chronic condition of constipation. Then number 4 is, that is colorectal cancer. Constipation increases the high risk of colon cancer. And then number 5 is kidney stone. Kidney stone is also linked to constipation. Those who are having frequent constipation, they are at high risk of getting kidney stones. And also number 5, urinary infection is also linked to constipation. Those people who are having frequent urinary infection and they are going to urologist and getting the treatment of antibacterial antibiotics, broad spectrum, but they have to check their constipation and consult their gastrointestinal doctor. So that is linked, your urinary infection is linked to your constipation risk factor. Number 6, autoimmune disease, being rheumatoid arthritis, all this inflammation of your muscles or bone or cartilage is linked to the constipation. Constipation itself is inflammation. Itself is toxic, itself is poison. And the latest research publications, I have gone through some latest publications, and they are suggesting that constipation is directly linked to autoimmune disease like rheumatoid arthritis and lupus. So in the last but not least, as a chemist, organic chemist, my recommendation and my experience of medicinal chemist, I will recommend and suggest, please change your lifestyle and shift to live food, means that is very rich in fiber, and some other ingredient like antioxidant and anti-inflammatory foods, and avoid dead food, means junk food, and those which are more acidic like animal products, so that your chance of risk of constipation is drastically reduced. It is not a disease, it is a symptom, and by changing your dietary habits you can control. So with this I will stop. Thank you very much for watching the lecture.